What also I think about when I'm talking with patients is what is their comfort level? Because the reality is what we're looking at is trying to develop trust between two people to create a team so that we can figure out what works best so that both people on the team feel comfortable and respected. And so I think above everything else, having that trust makes the biggest difference. And then having someone who has good resources so that they can integrate in all these different modalities to say, you know what, this would be a really great option for you if we tried this particular medication. But in the meantime, while we are doing this, for example, if we're trying to control blood pressure, we might need to control your blood pressure because we want to make sure that your vessels, or like I like to tell my patients, we like to make sure that your pipes are staying protected so that the pressure doesn't get too high. While you lower the pressure, we're going to work on diet, we're going to work on ways to do exercise, increase stress management, so that all that stress that's happening at work and home is also managed. So we're attacking it from many different angles, and so the way that I think about it is helping to reduce any immediate dangers while working on the things that provide long-term benefit.